Emergency response, falls, fire, medical events. As a home health aide, HHA, you are often the first person present when an emergency occurs. Your ability to recognize signs of danger, respond quickly, and remain calm can make a life-saving difference. This lesson covers how to handle three major types of emergencies in a home care setting: falls, fires, and medical events, such as stroke or breathing difficulty. You'll learn how to react appropriately, follow care plans, and communicate effectively with supervisors and emergency personnel. Responding to falls. What to do if a client falls? Stay calm. Reassure the client and avoid sudden movements. Do not move the client unless there is immediate danger. Example, fire. Check for injuries. Ask if the client is in pain. Observe for swelling, bleeding, or deformity. Call for help. Notify your supervisor immediately. Call 911 if needed. Example, if the client is unconscious or injured. After the fall, document exactly what happened, including time and location of the fall, what the client was doing, any visible injuries or complaints, actions you took. Help comfort the client and wait with them until help arrives. Prevention tip: never try to lift a fallen client alone. Doing so could injure both you and the client. Wait for trained help. Fire emergencies. Immediate actions. Assess the situation. Is there smoke, flames, or heat? Is it safe to evacuate the client? Activate emergency response. Call 911. Pull a fire alarm if available. Evacuate safely if possible. Assist the client using a safe route. Stay low to the ground to avoid smoke. Never use elevators during a fire. Key fire safety principles: RACE, R, rescue, move clients away from danger. A, alarm, call for help or activate the fire alarm. C, contain, close doors behind you to slow the fire. E, extinguish, use a fire extinguisher only if trained and safe to do so. Know your environment, be familiar with exit locations, fire extinguishers, smoke detectors, emergency contact numbers. Medical events: stroke, seizure, difficulty breathing. Stroke, think fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. If you see any of these signs, act immediately and call emergency services. Keep the client safe and in a comfortable position. Do not give them anything to eat or drink. Seizure, do not restrain the client. Protect the head with a pillow or soft item. Move objects away to prevent injury. Time the seizure if possible. After it ends, place client in recovery position, on their side. Call 911 if seizure lasts more than 5 minutes. It's the client's first seizure. Client is injured or does not regain consciousness. Difficulty breathing or chest pain. Stay with the client. Help them sit upright to ease breathing. Loosen tight clothing. Call 911 immediately. Do not leave the client alone or attempt to diagnose the issue. Communication and reporting. When to call for help. Always notify 911 in life-threatening situations, your supervisor as soon as possible, the client's family if required by agency policy. Accurate reporting includes time the event occurred, what happened before, during, and after, what you observed, symptoms, behavior, what actions you took, names of people you contacted. Keep calm, clear, and concise. Your detailed report helps the care team respond effectively. Emergencies can happen at any time, and as a home health aide, your response matters. Calm thinking, preparation, and communication can protect lives. Always follow your agency's emergency protocols and trust your training. Never hesitate to call for help when in doubt. Your role is not to diagnose, but to respond quickly and appropriately. Emergencies can happen anytime, and your quick, calm response can save lives. Follow protocols, trust your training, and call for help when needed. Your actions make all the difference.